Okay, I'm here with Amy Fenn of the District 4 Department of Health of Georgia. And how are you doing today?
I'm good. How about you?
I'm doing wonderful, as well as I can be, considering I'm supposed to be sheltered in place at 6 o'clock today. It's Friday, April 3rd. And we're recording this. So how bad is it?
Well, Governor Kemp's statewide shelter-in-place executive order speaks volumes to signify how bad this really is. Going back to, I believe it's about March 14th, Governor Kemp has been sort of, I guess you could say, ramping up things from the state office and the governor's office as to how the public should proceed. So once he is signed the statewide shelter-in-place executive order, that, to me, speaks volumes.
Yeah, it's it's pretty bad. So we're sheltered down until when does it end?
I believe that ends on April 13th at midnight.
Okay. I thought it was April 13th. I didn't want to speak out of turn, though.
Yes.
Okay. Is there a possibility of it being extended?
There's always that possibility. I do believe what will drive that is if people abide by sheltering in place, social distancing. So pretty much the public is going to drive whether it's extended or not.
Okay. It's been said that 40 to 70% of the world become infected with coronavirus. Can you respond to that?
Just collecting data from other countries that are ahead of the U.S. in this pandemic, it is, headed that way. The thing about it is it's been said that 40 to 70% of the world will become infected. So we've got to, really ramp up testing so that we can get those tested, the people tested, as well as collect data from not just the U.S. but other countries as well to be able to, state that.
Okay. How do we prevent catching it from here in LaGrange?
Okay, catching it here in LaGrange is just like anywhere else in the world. Everyone I know is probably tired of hearing the term shelter in place or isolate, quarantine, social distancing. There's a couple of new terms that have been thrown out there now, or a new term, physical distancing. So the best way to protect yourself is to stay away from others. And when we say that, of course, there's some people that have to go to work. So if you're in a situation where you have to work, please maintain it that at least that 6 feet between you and your coworkers. Hand washing. You can't wash your hands enough. If you do not have access to soap and water, please use hand sanitizer. And the other way to protect yourself as well as others, if you're sick, please stay at home. What we're seeing a lot of right now is people are saying, oh, it's just my sinuses and my dry cough. Well, what we're also seeing is some of those people who thought it was sinuses and a dry cough are turning up to be positive for COVID-19.
Oh, that's no good.
Nope.
That's no bueno. All right. So what are some preparation steps to take?
The preparation step to take, of course, you need to make sure that you have the ability to take care of you and your family as we do shelter in place. That does not mean that you cannot go to the grocery store. That does not mean, for everyone to run to the grocery store. But you never know who's going to be next as, becoming ill or sick. So you need to make sure that at home you have the capability to shelter in place for at least 2 weeks.
Okay.
Public Health is used to this a lot, especially during hurricane season. So we say at least have a 2 weeks supply of food on hand. Mm-hmm. So in order to prepare is, make sure you have plenty of food, hand sanitizer if you can find it, and cleaning supplies.
Okay. All right. So since we're already there, what are the symptoms of COVID-19, or the coronavirus as it's commonly known?
Okay, the symptoms are a dry cough, a fever, body aches, fatigue, and some people are presenting with GI symptoms, vomiting and diarrhea. So that's what we're seeing. Most people complain of to begin with is the dry cough, and some have complained of a sore throat. So when you think about it being pollen season in Georgia and allergies, a lot of these symptoms can be, really easily confused with someone that has seasonal allergies.
Yeah, that's quite confusing. Hence the
Yes.
hence the confusion. All right.
Yes.
And how is it transmitted?
It's transmitted through respiratory droplets, meaning anyone that's coughing or sneezing, those around them, once I sneeze into the air and you inhale, it can, actually could go into your eyes and, if you're breathing in, your nose, your lungs. So that's why it's so important to keep that distance from others. And, again, stay home if you're ill.
Okay. And how does this differ from the seasonal flu? Which we were all familiar.
From the seasonal flu is mainly what it's caused by. COVID-19 is caused by one virus, which is the novel 2019 coronavirus, now called severe acute respiratory syndrome coronavirus 2. The flu normally is caused by several different types and strands of influenza viruses, and so that's their differences, and they're pretty much transmitted pretty the same through the airborne route.
Mm-hmm.
And it is easy. When you become ill with COVID-19, as well as some of the people that we have talked to that thought they had COVID-19, but they actually tested for seasonal influenza, their symptoms really mimicked COVID-19.
Okay.
So to add further confusion to that, when someone is being evaluated for COVID-19, a lot of physicians are going ahead and testing for seasonal influenza as well as strep throat.
Okay. A bit off topic, but what's the difference between an epidemic and a pandemic?
Okay, an epidemic is an increase in the number of cases of a virus or disease beyond what is usually measured in like a specific area or a geographical region. A pandemic is a virus or a disease that spreads across many countries and affects a large number of people. So if you remember when this first started, it was being labeled a epidemic, mm-hmm. and then as it spread to multiple countries, that's when it was labeled a pandemic.
Got it. Okay. What do you think most people are missing right now? We know the basics. Stay home, wash your hands, avoid other people. But what are we missing that might escalate or exacerbate the problem right now?
I think what we're missing in general is yes, people know the basics, but they're failing to abide by those basic recommendations. And it's been said several times that those 60 and over, 65 and over are probably going to get sick quicker than the younger. So we sometimes have a false sense of, protection, and that is not true because we're seeing people of all ages that are testing positive for COVID-19. Mm-hmm. So we would like to caution everyone. Anyone is vulnerable to this.
Yeah, I've been watching the data daily from the health department's been publishing for the state of Georgia, and my demographic, the under 40, the under whatever it is, the under 50 demographic has been the largest in the state of Georgia, actually.
Yes.
That's been quite troubling.
And we're going to see that. We're probably going to see more troubling data as more test results come back. So that's why we're wanting, the public not to think, oh, I'm protected. It's not going to happen to me just because I'm 25, because that is not the case.
Yeah. I've been listening to a lot of podcasts lately that saying pretty much just that. Yeah. Again, no bueno. So how does the mortality rate of, well, as this is an outdated number now, but 3.4 compared to other global epidemics and or pandemics?
All right, the last, true pandemics were the Spanish flu of 1918 and the flu pandemic of 1968. By definition, of course, like I stated earlier, a pandemic means the entire world is exposed or possibly infected. Just to give you a little bit of information, the mortality rate of the Spanish flu is about 2%. But then again, you have to assume the entire world was exposed to come up with that rate. Mm-hmm. So, of course, right now, the latest mortality rate, as you referred to, that we know from the positive is about 3.4% now. But, we're pretty confident in public health that it's much larger than those who have currently tested positive. So, in the end, the final mortality rate will likely be lower once we get data and are able to determine everyone that's infected.
Okay.
So So, the more they're infected, sort of skews your numbers as you're trying to look at old data. But what we want people to realize now, whatever the mortality rate is, people are really fixated on the numbers in Georgia, the numbers in the U.S. We know the virus is here. We know it is being spread throughout the community. When this first started, we focused on those who are traveling, but now we know it's being, spread in the community. So low numbers, high numbers, it's here, so we need to be really careful.
Okay. We've heard it over and over again, but last question just one more time. What about the immunosuppressed, small children, pregnant women, and those above the age of 65? Are they more susceptible to the virus? I know it's kind of a duh question, but I'm going to ask it one more time.
Yes, they are more susceptible just because of their age. Because as we age, we have more chronic health conditions. But again, we do not want to give the younger that are diabetics, and that may be, I'm 45, I'm a diabetic, free to do anything. Mm-hmm. So there are categories or groups of people that are get sick easier in general. But then, of course, as we're seeing with the numbers, anyone can get COVID-19. And I think that's what is happening. People are like, this question, we've heard it, like you said, we've heard it over and over again. So when people start to go out, they think, oh, I'm not one of them, so I'm okay.
Yeah. I'm going to ask a question again specifically for my situation, just because I've got two small children at home, both under the age of 5. I've got a 2-year-old and a 4-year-old. How bad is it going to be if they get the coronavirus?
Well,
how bad could it be? How bad could it be? Sorry.
I mean, it could be anywhere from, we've had some people that were tested for different reasons that showed they were positive and didn't have hardly, any symptoms.
Okay.
On the other hand, we've had people that were severely ill, ended up on ventilators. And I believe I heard in the news earlier this week, I believe in Connecticut, there was an infant that I believe that's 6 weeks old that passed away. So that, again,
okay,
it can be harsh for any age. It's according to what's going on with your body at the time when you're exposed.
Okay. Yeah, I saw there was a 39-year-old man who was perfectly well in Florida that passed away with the COVID-19 virus this week too. But yeah. Okay. So when will large gatherings be safe again? When will we be safe again?
I wish I could answer that for you, but again, as I said, I think earlier, it's according to how serious the public takes the shelter in place, the social distancing, the physical distancing. If we can get that under control, we're going to help stop the spread of the virus, and which will lead us back to what we used to know as our normal daily lives.
Okay. Is that a nice way of saying settle in for a long ride?
More or less.
Just some general questions about the executive order, because there was an executive order that was published yesterday, and because that's what everybody's waiting on. There's an executive order published yesterday. Some questions. Do I need a paper to show? Do I need a paper which to show that I have the right to be out?
Well, as related to working, you do not have to have a letter from your employer or the government to prove that you fall into one of the essential services, necessary travel, or the minimum basic operations. But one thing to keep in mind is, it's up to the the local communities. If, say, the police department or the sheriff's department decides, there's way too many people out, they may start pulling people over asking. But as far as the executive order, what it's stating is that you do not have to have a letter. But I can tell you, I work, for Public Health, and we all have a letter that we have in our cars.
Okay.
We all have our badge, just to show that we do need to be out to travel to and from work.
Okay. What happens if I violate the order?
If you violate any of the terms of the order, and you can visit the DPH, Georgia Department of Public Health website or the governor's website to actually see the entire order. You're actually committing a misdemeanor, which is a crime in the state of Georgia. But from public health standpoint, we just want to make sure people are properly educated. Even though from the law side it is a misdemeanor, but we just feel that if we can get everyone properly educated and on the importance of sheltering in place and following these guidelines, recommendations, it will not lead to a misdemeanor. Our law enforcement does not have time to deal with that kind of stuff, I guess you could say.
Okay. Makes sense. And they want to fill the courts up.
That's correct. And the other thing is if you think about it, they're releasing people. I don't think that you end up in jail for a misdemeanor, but they're releasing people now because the crowding in the jails. Mm-hmm. So we do not need anybody visiting any of the jails.
Which makes sense. Let's say I go stir crazy and I want to play some sports.
Yes, you can go out and play golf. You can go out and walk. The thing is gathering the 10 or more people are banned unless you're 6 feet apart. Our recommendation is, I live with my husband and my daughter. Physical activity is very important. I need to get out of the house in the evenings. If I'm going to walk, it's okay if I walk with my husband and daughter because we live together in the same home. We do not have to have that 6 feet between us. But now if I chose to walk with my next door neighbor, we would need to be 6 foot apart.
Okay. But how should we think about preparing as we head into the zenith hour of the executive order?
In order to prepare, remain calm. Like I stated earlier, make sure you have plenty of food on hand. In Georgia, sometimes if it's going to snow, we all run out and buy milk and bread. For some reason, with COVID-19, we're all running out and buying. I guess hand sanitizer is a good thing to buy, but toilet paper and paper towels. You can't eat toilet paper and paper towels, so make sure you have plenty of food on hand. The other thing, the biggest part of preparation is properly educating yourself. For some reason, people think anything they read on the internet is true, which we all know that is not true. The biggest part of preparation is like visiting sites such as the CDC website that is has information for everyone to view that is fact-driven, not pretty much my opinion. So the biggest way to prepare is to make sure that you are properly educated. Okay.
Well, Amy, thank you for your time. This has been Amy Fenn of the Georgia Department of Public Health. Thank you so much. Hey, LaGrange.
LaGrange.